Good evening. Tonight's topic is one that is very familiar to American women. About 1 in 3 currently in America have something called bacterial vaginitis or vaginosis, which is essentially a oftentimes chronic overgrowth of bacteria. So the way that I describe this is that all women have a kind of a nice balance in their vaginal area. There's bacteria and there's yeast. And they tend to, if everything's going well, be nice and even and balanced in those areas. However, some things can tip the scales one way or the other and cause some of the most common visits to the doctor's office. Fortunately, we now have a relatively new protocol that we're using in my clinic, where instead of having to do a complete pelvic exam to investigate the discharge, you can basically be taught by the technician how to do a little self-swab. The technician collects it, goes off to the lab, and voila, 15-30 minutes later you get an answer to what was causing the issue. That is, if the problem was yeast bacteria or this little bug called Trichomonas, which we don't see that often, but which occasionally can cause some problems as well. So what are the characteristic findings for bacterial vaginosis? So in other words, what are the classic signs and symptoms? Well, basically extra discharge. Usually it's thin, it's gray. It sometimes has a little bit of a fishy odor, which of course in modern times is a source of many anti-women jokes, I guess, is a polite way of saying it. But anyway, on exam, when you take some of the discharge and look at under a microscope, you see what's called clue cells. In other words, you see the cells and they look as though they've been speckled with little, just little dark dots, I guess. So we call those clue cells. In other words, a clue that it's the problem is the bacteria clinging to those little cells. So the usual risk factors for developing this, of course, being female, having a imbalance of the pH of the vagina. So normally the pH of the vagina is acidic, so sort of like tomato juice. And I'm not encouraging putting anything up into the vagina. This is just a model to show what is the normal acidity, what should it be like. So think tomato juice. And when the overgrowth of bacteria is happening, they create a environment that is more alkaline, in other words, less acidic, and more of the pH of coffee. As a matter of fact, one of my gynecology colleagues that I worked with many years ago had actually ordered some special pH strips. I'm not sure where he got them. This was about 10 years ago that I worked with him. And he actually, as part of his clinical practice, would take one of these pH strips and put it into the vagina and get a little bit of discharge, and he could quickly see where in that very narrow spectrum the discharge was, and he used that as one of his indicators for treating bacterial vaginosis. So about 50 to 75% of the women that have this condition actually don't notice it. It just goes along as part of their usual routine, and they really have no symptoms that they speak of. Sometimes the discharge is a little bit more noticeable after sex, and again, thin gray. Occasionally itching can be involved. Occasionally you can get discomfort during urination or during sex, or redness and swelling. That's rare, but occasionally those things can happen. So generally speaking, the difference between the bacterial vaginosis and the more often common yeast infections is that the discharge for the yeast infections tends to be thick, white, cottage cheese-like, and itchy, usually very itchy. And of course, that could be cured with a single pill of diflucan, my favorite way of doing that, or with the over-the-counter treatments, because it's so characteristic. A lot of women, once they've had one, they very quickly recognize if it comes again. The things that predispose people towards yeast infections include things such as some systemic diseases and recently taking a bunch of antibiotics. So oftentimes I'll ask, hey, if you're getting some antibiotics, do you tend to get yeast infections? And sometimes a pill-in-pocket approach, having a diflucan handy when you need it, can be very time-saving and helpful as well. Please also see my video on chlamydia. I haven't done one on gonorrhea yet, but it's going to be on the to-do list. So obviously there's more than one different kind of bug that can cause a discharge. So if you've got any concerns, of course, please see your local provider and get tested. All right, so back to the topic at hand, so the bacterial vaginosis. So why do we care about it, other than the fact that it's one of the most common gynecological complaints that women, especially younger women, have and are coming in to see us for? In certain situations, this can actually cause complications. So, for example, if a woman is pregnant and they have bacterial vaginosis, they're actually more likely to have a preterm delivery, which some people might think, wow, I get the baby out a little sooner, great, and not so great, because preterm babies are at much higher risk for many, many medical issues, so you don't want to get out too soon. Untreated bacterial vaginosis, if a woman is then undergoing like hysterectomy or implantation of an IUD or some other issue, then sometimes it can actually lead to infections a little bit more commonly because, of course, too much bacteria presumes easier infections. Speaking of surgical infections that are higher, also, if a woman is having it, they're also at a little bit higher risk of catching a few other conditions, such as HIV, genital herpes, gonorrhea, and chlamydia. So, again, it's something that is very commonly carried by women, but can lead to more complications later on. So how do we treat this, and what do we do? Most of the time, there's metronidazole, or flagyl is another word for it, and a few of my patients have been trained that they need to take this orally, which, yes, it works, but it's also like setting off a nuclear bomb in your gut as far as your other bacteria are concerned. And whenever possible, if you've got a local infection, it's best to try, if you can, to treat it locally. So I recommend the gel. Basically, it's a gel that goes in the vagina every night for 5 nights. No sex during that time, please, because it basically makes the gel get out of there. And sometimes using a pad or something could be helpful during the daytime. And then once the 5 nights are over, should be cured. Occasionally people get a yeast infection on the tail end, so keep an eye out for that as well. If you do take it orally, it does cause metallic taste and nausea, and it can cause a little bit of anemia. Another problem is that if you're taking metronidazole, you can't drink alcohol, which I don't tend to recommend much of anyway. And there's some other more serious things like interacting with other medications like Coumadin, whereas the vaginal gel doesn't have any of those side effects. And then sometimes folks also will use a clindamycin cream that's specially made for this area, that's used every night for 7 days. There are a couple of other varieties where there's a 1-day and a 3-day ovules and things. The downside to that is if you use the clindamycin cream and latex condoms, then the condoms are more likely to break, which might lead to another consequence, such as pregnancy and other STDs as well. There's actually been some debate over the years back and forth as to whether bacterial vaginosis is a sexually transmitted disease or not. And It actually, the latest from my up-to-date article I'm reviewing here tonight is that they are leaning on it being a type of an STD or a sexually transmitted disease, but not to the point where treating the man seems to make any difference. Rather, they seem to be suggesting if there keeps being recurrent bacterial vaginitis, that basically condoms are used to help reduce the risk for the woman of this. So relapse, of course, is very common. About 30% of women who initially improve after treatment get it again within 3 months. So 30% within 3 months. And then over half of women get a recurrence within 12 months. Not entirely sure why all this occurs, but that seems to be the case. And so basically when you get a relapse, you just repeat whatever treatment worked. And occasionally, if you get more than 3 episodes in a year, sometimes we'll use a longer treatment. In other words, the vaginal gel twice a week for 3 to 6 months, and so forth. The clindamycin is not recommended as a preventative. And they're talking about probiotics, and we don't really have much evidence that they're helpful. There's a lot of various internet-themed things. We usually recommend staying away from douching. I also don't recommend the yogurt on a tampon. And generally speaking, sometimes people will try to say, well, the vaginal flora is disrupted, let's go ahead and get a bunch of lactobacillus and try to put it up in there. And part of the problem with that is food products and vaginas generally don't mix very well as far as the health goes. Sometimes if people are using food products, whipped cream, strawberries, whatever things that people do sometimes in that area, basically it's like feeding the bacteria, and the bacteria say, yay, and next thing you know, you've got yourself a problem again, or for the first time, whichever it is. But anyway, so the vagina is a self-cleaning mechanism. In other words, it does not need anything extra going in there. Again, there's a few different schools of camp on that. I had a women's health nurse that I worked with for a few years, and she would recommend a little bit of vinegar in a quart of water. So again, there's a few opinions on this. The official medical opinion that I've seen the most commonly is just avoiding douching altogether. And it does make a little bit of practical sense because water is a pH that is too alkaline for our environment. Remember, you're looking for the acidity that's the same as tomato juice. And if you remember having tomato juice, it is tangy and acidic and such. And obviously water is neutral pH, and so if you get the balance wrong, you end up swinging back towards the environment that favors the bacteria that cause the problem. Multiple sexual partners does put you at higher risk for developing this and other STDs, of course, so limiting the number of partners over the course of a lifetime in particular. Sometimes birth control pills might be helpful, they're saying, but again, condoms, despite whether you're using birth control pills or other forms of birth control, can be helpful as well. So I do have a couple other things that are related to risk factors. One thing that I've noticed also is that occasionally if women are having some other systemic diseases, such as, let's say, they're trending towards diabetes or prediabetes, just something that I've noticed clinically. I've noticed an increase in all sorts of different types of infections, whether it's yeast infection or bacterial vaginosis. So although I don't have any studies on that, something that they might look at. So it's certainly something that sometimes I keep in the back of my mind is, okay, is there anything else going on when somebody has recurrent infections? Very, very rarely, sometimes a tampon or bits of a tampon can get retained. Sometimes when people have a IUD, which has little strings that go down, bacteria in general like to create a film and that's like a self-protecting thing. So if there's a string, it's possible that maybe the bacteria are just grabbing hold of that string and causing themselves a nice little place to live, essentially. Another thing is there's a link between the amount of phytonutrients that are in the body and the risk for developing BV. There was an interesting set of studies that Dr. Greger in nutritionfacts.org went over with the Bacterial Vaginosis and Diet presentation. Short version is that when you're looking at the phytonutrient profiles, like how much vitamin C is in somebody's blood or how much vitamin A in the form of beta-carotene, those are proxies for how much of these fruits and vegetables are the people eating, And the women that had higher levels actually had lower rates of infection, whereas the amount of saturated fat that was in the diet tended to also swing the bacterial vaginosis more towards happening. So in our American country, where do we get that the most? We get it in the form of chicken, dairy, and sweets, such as donuts and cakes and things like that. Tend to be some of the most common sources of saturated fat nowadays. One other treatment for bacterial vaginosis that's also been reviewed on Dr. Greger's website here is the Vaginal Vitamin C. This is similar to what in some of the doctor versions of the up-to-date article talk about. Occasionally we'll try to treat recurrent bacterial vaginitis with a boric acid supplement. Around here, one of my patients was able to have one of the gynecologists that was able to prescribe it, and they were able to find it, I think it was down in Destin, one of the pharmacies was able to carry it, and they tried it. So that's a totally different regimen, and definitely something I'd recommend discussing with your gynecologist, preferably, before using, under prescription, of course. But the bacterial vaginosis with vaginal vitamin C is another interesting study. It's kind of along the same lines. So the idea is that, again, you want to create a more favorable environment for the good bacteria or lactobacillus to live in. And what they studied was, and mind you, this might be a little biased because it was a company that's creating and selling these vitamin C capsules. But what they did was they did a safety and efficacy trial. And basically, they took 277 patients with at least 3 of the cardinal symptoms, a white or gray discharge that smoothly coated the vaginal walls, a pH that was acidic or greater than 4.5 compared to, again, what's supposed to be, a fishy odor before or after KOH preparation, and the clue cells on exam. So in order to meet the criteria, they had to meet at least 3 of those 4 usual symptoms. And what they found was with their using once a day for 6 days, basically 55% with the treatment were cured, and about 25% with the placebo were cured. So that's, again, just something, FYI, it's kind of a relatively novel or new treatment, and probably will need more studies out there. But in the comment section, I was able to kind of dig up the original trial that's published on PubMed.gov, and found the company. It's interesting. The company does have a number of different brands around the world, and it looks like they are kind of difficult to get just without obviously having a prescription on there. And not every country in the world, I guess, carries their products. So anyway, so hope this was helpful. Again, it's just this is a very, very common disorder, and most of the time it just is something that keeps on coming up. Occasionally, rarely, there's other weird things that can happen. The vagina and the rectal wall are very close to each other, and so once in a blue moon I have seen cases where the woman had recurrent infections, and it turned out that there was a a small opening or fistula, we call it, between the two. If something like that is happening, you would also be getting sometimes stool, or maybe not even quite as much as stool, but like a really foul kind of discharge and gas coming through as well, just because those things, when they get into the vaginal canal, can cause problems. So anyway, so thank you for joining me tonight, and I hope you enjoyed this talk for our women's health. And stay healthy, wealthy, and well. Take care. Till next time.